If you clicked on this video, then you've just found out that your child needs to undergo surgery. Maybe you're a teenager and are affected yourself. You probably have a lot of questions right now. Of course, you should always talk to your doctor, but I'll try to explain the most important things to you now and answer the most pressing questions. A surgical procedure, or surgery for short, is often an important step in diagnosing cancer in children and adolescents, and sometimes it's also the first step in treatment. This is true regardless of where the cancer is located, how big it is, or whether it has spread or not. Because during an operation, doctors can learn more about the illness in the first step. Not everything can be seen on an X-ray or during a CT scan. Sometimes you just have to look inside or take a sample. For example, if your doctor has said that they want to do a biopsy, it means the following. Using a needle, they will take a small piece of tissue that they suspect might be malignant. The tissue is then examined in the lab, and afterwards the doctor can say with certainty whether and exactly how the cells in the body have changed. And then the doctor can usually also say exactly what type of cancer it is and how best to treat it. In short, a biopsy, that is, a tissue sample from the tumor, helps doctors make the correct diagnosis. And then you can decide what the treatment should look like. It is also possible that the doctors can already remove the tumor during the surgical procedure so that no further surgery is necessary. You've probably also heard that every cancer is different. It may be that the treatment is completed quite quickly after the operation, but it can also be the case that the treatment takes longer. Whether and to what extent chemotherapy or radiation therapy will be necessary afterwards can be explained to you by your doctor. Either way, you have quite a journey ahead of you, paved with many, many questions, and understandably, also with a few or even many worries. That's why we'd like to support you along the way. In many videos on a wide range of topics related to childhood cancer, we accompany you and your family with explanations, advice, and a few tips. We want to help you better understand the complicated medical issues to give you confidence so that you can approach the treatment with optimism. And that's why we're starting right here, where you are. Because as I said, surgery is in most cases the first step in treatment. Today I explain to you why that is. In further videos, I'll tell you how you can prepare for the conversation with your surgeon. I'll explain to you exactly how the day of the surgery will go, what you can do before, during, and after, and also what you don't have to do at all, even if you might think you do. I'll take a look with you at the different types of surgeries available for children and adolescents, how general anesthesia works, and what it feels like. Whatever questions may come up, I hope I can answer them for you. And always remember, if anything at all ever remains even slightly unclear or causes you any concern, please feel completely free to speak with the medical professionals and doctors. Because that is what they are here for, to help you.